Why are you doing these videos for me today?
So many reasons. Um, Pay it forward because they really help me. But I think my biggest reason is to show women of my age that it's not too late.
We are post-op day 1 with Joanne. How are you?
I'm fine,
So
just tired.
Joanne is the sweetest. She is 66 years old, and just yesterday, 66 years young, because she's a young 66. Just yesterday, we did a deep neck lift, deep plane extended facelift, lower blepharoplasty,
Hmm.
brow lift, full face laser resurfacing, and some specialized fat transfer. You hear a lot now about facelifts in the 40s, and that's the common time to do it these days. That doesn't mean you can't get a fantastic result in your 60s and 70s,
Absolutely,
right? I think that's an important
absolutely,
point,
and beyond.
and beyond.
Um,
As long as you're healthy, that's the key. If you're
yes.
healthy, the window doesn't close. If you're not healthy, the window might close in your 40s.
Hmm.
That's the real key.
Yeah.
Yeah. We had a different plan actually when she came in yesterday. We had done a Zoom consultation before, and because camera perspectives are slightly different and what you see in real life is slightly different,
Right.
we had considered a chin implant. The previous plastic surgeon had told her years ago that she might need a chin implant. That had kind of stuck in there. And we had considered a lip lift. We were not on track to do a full face laser. But when we saw her in real life turn towards me, it became evident that there was no reason for a chin implant. Her chin projection is absolutely perfect. Breathe through your mouth just a little bit. Her lip length, it's swollen now, but her lip length is perfect for her skeletal frame. So I actually took the chin implant back off with her permission, took the lip lift back off. And we did a little tiny touch of fat to the chin because she had a previous cyst removed with that left a depression. Go ahead and turn back that way. And we decided to go ahead and do a full face laser. She had a little laser a couple months ago, but we decided to do a good one now.
Hmm.
Besides being tired, you had one other major complaint this morning. Not complaint.
Yeah.
Medicine says complaint. One other
My
report this
mouth
morning.
is as dry as a camel's.
Yeah. So she could hardly talk this morning
Mm.
and super, super dry. I did not do any salivary gland reduction on her. And some people with bulges of salivary glands, I will reduce the salivary glands as a part of surgery. And you can imagine if that person came in the morning after surgery, super dry and uncomfortable, they would be very concerned. Oh my gosh, it's because we did salivary gland work. I'm super dry. This is my life from now on. No, the dryness that she's experiencing, she had no salivary gland work, and she's one of the most dry feeling ones. It's from surgery. So many of the medications have anticholinergic side effects, which make your mouth dry. And then also, you don't eat or drink the night before surgery. You don't eat or drink much the day of surgery, despite IV fluids. And so it's normal to be dry. That will pass within a day or two.
Mhm.
Speaking of eat or drinking, how have you been doing on that?
Really well, I think. Do y'all think? I think I've been doing really well drinking
She's looking
and
at her
eating.
sweet sister over there, and what we provide nursing
My
service
sweet shot.
for the first 24 hours. So she's looking at her nurse and her sister over there in the background.
Yeah.
What else would you like these guys to know about your first day?
No pain. You definitely have the helmet head. Like it's a really weird feeling.
Tell me what helmet head means.
Like you have a helmet on with no padding under the helmet.
Yeah, like this doesn't feel like it belongs to you, maybe.
Right. It's a helmet. There's a helmet. There's an extra helmet on here.
Yeah, it's a combination of
Yeah.
swelling and numbness and tightness of the scalp will
I
make
can
that feel.
feel. I can feel more than I thought I. Like I can feel my ears, the side here. Um, I can feel this, but not great. Um, and the nurses have been everybody, like everybody says, it's like top notch, sweet as pie. um, and you have been, like everybody says. So um, I would definitely. I already don't regret it, and I'm gonna look bad worse in a couple days, and I don't regret it. I think that everything's gone so smoothly from leaving Greenville. Yeah, right. The flight, everything.
Good.
Yeah, I've been blessed. I've
Well,
been blessed.
you deserve it. You're the sweetest.
Thanks.
Thank you for letting people see how you look on this first day, and
Mhm.
we'll see how you evolve over the next 10 days while you're with us.
Yeah.
Thank you so much.
Fingers crossed. Thank you so much.
Good morning. We are here with Joanne today. She is post-op day 7 with having surgery with Dr. Nyack, and we did a deep plane facelift, neck lift, brow lift, lower eyelids with fat transfer, and a full face laser. Wow. You
Yeah,
look you're looking more like yourself. I'm sure you're thinking that too.
a little bit. I'm anxious to see.
Yeah.
I'm really anxious for the next few days.
Oh yeah.
Today, last night and today was the first day I think I can see glimpses of myself and not look like Cabbage Patch.
Cabbage Patch Kid. Yeah. A lot of people give themselves an avatar name or some kind of cute name like that. So you're Cabbage
Yeah.
Patch Kid. I love it.
But I feel great. Just swollen. Just swollen. I have minimal bruising, which makes me happy.
Yeah.
And I've been sleeping fine.
Good.
Yeah,
That's a
everything's
challenge.
good.
Sleep is always a challenge.
It's a big challenge.
Yeah, laying flat on your back is
Yeah.
what Dr. Knack requires. It's a challenge, but most
Yeah.
of the time, believe it or not, people will tell me after their 2 weeks they have to do that they have converted to back sleeping, even though they fought it the whole time. It happens more often than you think. So
Really?
we'll see with you. You
I
tend
don't
to be
think so.
She says she tends to snuggle in, so
Yeah.
you'll be ready for
Yeah.
that.
But everything's been great. I only had a bad maybe one day.
And that was your post-op day 3.
Great.
And then she had her pothole day 3.
But it wasn't so potholy. It was just very uncomfortable.
I got you.
Very uncomfortable.
That's when swelling peaks, so
Mhm.
it's normal to feel a little more tight, a little more swollen, and
Yeah. And everybody assured me it'd be fine, and it was the next morning. So
good.
everybody's been great. Everything's been good. I'm excited.
I love to hear
I'm
that.
excited for the next 2 weeks
Yeah.
to wake up and put makeup on
I'm sure. I know that's what
and
everybody
buy
thinking.
turtlenecks.
Yeah, exactly. One thing I did want to ask you about, a lot of people have a real fear of the laser part. Back in the day, lasers were very harsh. People look terrible. You're a week out from your laser. I still see that you have some swell or peeling to do, but was that painful? And be honest, was it painful? Was it, what did that feel like?
It was not painful at all. In fact, many years ago, I had a fully ablative CO2.
Okay.
That was hard because you want to scratch your face off.
Yeah.
This one with the vinegar soak, and back then I didn't even do vinegar soak. I think that took the itch, the
Right.
stinging out.
Yeah.
I had a little bit going on here, but the laser was to me nothing like I've experienced, even with other TCA peels I've had,
Okay.
which are deep TCA peels. This one, so to answer your question,
Yeah.
and be shorter than I should, was, is that it didn't hurt.
Good.
It's a great treatment. It's a great treatment in the right hands.
Exactly. In the
Yeah.
right hands. That's especially,
Yeah.
that's the key. It gives a great result. Patients used to wake up in recovery with old lasers and feel that on fire feeling. And really, the laser we use, if people are comfortable, they don't even mention the laser.
No,
Really.
I mean, I didn't feel on fire at all.
Good.
At all.
And it's just the icing on the cake with everything
Yeah.
else. And while you're back there. So,
Yeah.
let's see, what else? Are you getting out and about, or are you just kind of hiding out?
Yeah. No, we went out to dinner last night. We went shopping. I bought a couple dresses.
Oh, okay, good. Retail therapy.
Yeah. We're gonna go today because it's raining. We're gonna go to the mall.
Yeah.
And just walk about and maybe
Yeah.
buy a couple things.
Good.
Yeah,
I'm
just
glad
to
you're
get
getting out a little bit.
Yeah, we are. We've gone on walks. My nurse here has played pickleball, which gets me jealous. But,
Oh yeah, you're a pickleball player.
But
I love it.
yeah, she's been getting out. That makes me happy. I feel bad that she's.
Oh,
all
it's
the
nice
time.
to have someone take care of you.
Yeah,
That's
we've
awesome.
been binge watching TV, so that helps.
Perfect. I love it. But yeah, getting
Yeah.
out and moving around does help the spirits. It does help
It
the
does help
feeling.
with the swelling.
Yeah, I
too.
think it helps with the swelling too.
Yeah.
Not overdoing it, but just nice, slow walking strolls
Yeah.
is completely acceptable. It needs
Yeah.
the first few weeks. So
Yeah.
yeah, totally fine. All right, let's show people how you look. And you can see your neckline. You did get some sutures out today. So she did get the sutures out in front of her ears and under her chin. But there is her profile, which is already great. It'll come in even sharper as the swelling starts to resolve.
And then, you can't even see these anymore.
Yeah, she had little brow sutures up here that we
Yeah.
took out on day 5. So those are already out. But yeah, those will fade away to nothing. They all will fade away very nicely.
Yeah.
Hidden great. So, okay. Well, thank you for
Thank
sharing
you.
your journey with
Thank
everyone. I'm
you.
really looking forward to seeing you. Thank you.
I want to show you what a 66-year-old neckline looks like. Only in St. Louis is where you find a
Yeah.
66-year-old neckline that looks like that. You look incredible.
Looks better than it did when I was 20.
Our day 9 with Joanne. How are you?
I'm great.
You look
Getting ready
amazing. Yeah, so
Thanks to you.
yeah, getting ready to go home. So Joanne's 66. 9 days ago, we did her deep neck lift, deep plane facelift, lower lids with fat transfer and laser resurfacing. Didn't do her upper lids because she didn't need it. The brow lift captured all the excess skin. And I think that's all we did, right?
Yeah.
All right,
Yeah.
good.
Yeah.
So you were saying you're still a little bit blurry. Tell me about that.
My eye, especially my right eye, just it is blurry, like, and the movement seems different
Yeah.
as well.
Yeah.
So even with my readers on, I can't see that well.
Yeah.
To read a book or anything. Watch TV is fine, but yeah, to read a book or write things down, it's kind of odd.
Yeah.
Yeah.
So
But
there's
other than that, no problems.
two reasons for that. This is a very common report. So one, just like your face swells from the surgery, your cornea, the clear covering layer of your eye, swells a little bit. So that when your cornea changes shape, your focus changes. That's exactly how LASIK works. They use a laser to change the shape of your cornea to make you see better. Well, your swelling has changed the shape of your cornea to make you see worse.
Okay.
Obviously, as the swelling resolves over the next week or two, that will go away. Second thing that can be contributing is dryness. So we think about the lens focusing the light of the eye. That's just the fine tuning of the focus. The majority of the focusing that your eye does is when light transfers from air to the tear film. There's a difference in refractive index. And if you ever see like a pencil in an aquarium, it looks like a jagged line when it goes through the water. So that light's
Yeah.
focused by the tear film first. So if your tear film's not great, which is very common, eyes being a little dry after surgery,
Okay.
your vision's blurry.
Okay.
The same reason, like when you start to cry, your vision goes blurry. Too much tear film on your eye, and you can't focus, right?
Yeah.
So vision's a little bit blurry from slight dryness. Vision's a little bit blurry because the cornea, which is the next powerful focuser, is slightly swollen. And then the lens, which is the least important focuser in your whole eyeball, can't compensate for those
Okay.
things. So as your eye, you can use wetting eye drops,
Yeah,
lubricating eye drops will help.
and I was going to ask you about that. Using those eye drops over time, will you get not immune
Addicted to them or
yeah,
dependent on them?
addicted to them.
Nope, not at all.
Okay,
So
good.
you can use lubricating eye drops. They're non-addictive.
Okay.
So lubricating eye drops are no dependencies, and just a few more weeks. That'll go away. I have no
Okay.
concerns at all.
Great.
Feelings wise, how are you feeling?
Well, I can feel everything now. This is a little harder. Just right here. I feel everything. I'm amazed how much I can feel. I mean, it feels swollen, but I feel I feel everything. See other people say they can't feel part of this. Nope, I feel it all.
Yeah, well, I'm glad you're saying
Yeah.
and you acknowledge other people. Every
Yeah.
ride's different, man.
Yeah.
Some people they're numb for 6 months. Some people they come back in 9 days. So this is unusual. It's usually the head takes a little bit longer,
Well, yeah, it's right
and the
here.
edges take a little bit longer. Would you agree?
Yeah, this ball right here feels a little hard yet. This I feel everything.
Good.
So I'm happy with that.
And
I'm
then
happy with everything. So
yeah, so let's talk about that. So like most of my patients travel in. How would you were so kind to bring a friend who I thought was your sister the whole time.
she's my sister now.
Yes. But do you feel like process wise between the nurses and the drivers and the place where we have you stay and the visits, do you feel like that is a pretty mature
Oh
process?
my gosh. I don't know if it was luck because I picked up a penny in heads and also a playing card that if you watch Sex in the City, that's luck. But anyway, before I came, but everything has been seamless. From everybody is so kind, beautiful. But besides even under your roof, everything went seamless for me.
W-
Everything.
We're very lucky.
Nurses, rides, the airport, the rent a car, the travel, the weather. Well, we did have
Except
a
the
tornado.
tornadoes. Yeah.
But other than that, I felt safe, and everything is so seamless, and I'm very proud of the fact that I have healed so well
Well,
at my age.
a lot of that has to do with your health. You are a
Yeah.
very, very healthy person. You've taken very good care of your health,
Hmm.
and that is reflected by how well your tissues have done. I mean, that's the reason that your tissues have sprung back like a 40-year-old, like
Right.
for real.
Right.
Yeah.
I hope I don't age real fast. That's all.
Well,
That's all my only hope right now.
You won't. And the nice thing about these types of procedures is we take everything and during the surgery, I can literally feel where the tissue is meant to go. And so things are really put back where they started. it's still a very normal anatomic, normal construction. So people often ask how long these things last or do facelifts age weird. If they're done well, we unwind 15 years and then you age naturally from that standpoint going forward.
Not progressively like past your 60s, how it usually, well, for me anyway, after I turn 60 and most women, you lose so much estrogen that you accelerate in your aging.
Yeah. So
I think it's
we've
important.
unwound you 15
Yeah.
years.
Mm-hmm.
You will age naturally, same path of aging going forward with the same ways that you could have had before to control it. You still have the same ways now. So, hormone supplementation can help, skin care helps, all the normal injectables,
Okay.
lasers, all the things you would do if you had never had surgery and you're trying to prevent it.
Right.
You get those opportunities all over again.
Okay.
Unwound you 15 years and you will age naturally at whatever trajectory your habits support.
So okay.
Right. So if your
Not
habits
necessarily
support,
my age, but
yeah.
that
So
my habits.
so if you support good habits, your aging or your re-aging will go slower.
Great.
If you're not taking care of your skin, sometimes there's an artificial war between surgeons and non-surgeons. Non-surgeons do everything they can to keep people looking beautiful until they need surgery, and then they should pick right back up right after the surgery and keep it as long as possible till we ever see you again.
Right.
You know what I mean? Like they're very collaborative. So
Right.
I could not be happier with how you turned out, and you've
I
been so nice to let everybody follow you along.
It's just important to me to let people know at my age that it will last, and you can do it, and it will heal, and it'll be worth it because you'll still age, but not like you did before.
Yeah,
If
it's
you,
so
yeah, I
100%.
think that's important.
I want to do one last thing. I want to show you what a 66-year-old neckline looks like. Only in St. Louis is where you find a 66-year-old neckline that looks like that. You look incredible.
Looks better than it did when I was 20.
Love it.
So
Thank you. And please make sure to stay in touch with sending us additional photos.
I'm gonna send photos.
And I would love to see in person if you're ever able, 3 months, 6 months,
You
something
never
like
know.
that.
Margot's
Please
becoming
come
my
by.
friend. Maybe she'll fly me out.
Exactly. I hope you found this information helpful. If you did, hit that subscribe button and turn on the notification bell icon so you can see my future content.